My dear students, Assalamu alaikum. Welcome to my today's class. I am Dr. Sagia Afroz, Associate Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. Today I am going to discuss an important topic about diuretics. What is diuretics? The definition of diuretics is the drugs which causes diuresis. What is diuresis? It is the excretion of lots of electrolyte along with lot of water is called diuresis. Now, what are the classifications of diuretics? According to the site of action, diuretics are three types. Those who acts on proximal convoluted tubule. Number 1, carbonic anhydrase inhibitors, and number 2, osmotic diuretics. Those who acts on proximal convoluted tubule, carbonic anhydrase inhibitors are acetazolamide, methazolamide, dorzolamide, and the osmotic diuretics are mannitol, inulin, glucose and urea. The diuretics acts on thick ascending limb of loop of Henle that are also known as loop diuretics. The drugs are furosemide, bumetanide, ethacrenic acid and torsemide. Next classification, the diuretics acts on distal convoluted tubule. They are also known as thiazide and thiazide-like diuretics. The drugs are hydrochlorothiazide, chlorothiazide, polythiazide, and thiazide-like diuretics are chlorthalidone, indapamide and metolazone. Now, I am going to tell about the diuretics acts on collecting tubule that are also known as potassium-sparing diuretics. They are secondly divided into two groups. Number 1 is aldosterone receptor antagonist and number 2 is sodium channel blocker. What are the aldosterone receptor antagonists? There are two drugs, number 1 spironolactone and number 2 eplerenone, and sodium channel blockers are amiloride and triamterene. Now, according to the efficacy of diuretics, this is the another classification of diuretics, that is high efficacy diuretics, medium efficacy diuretics and weak diuretics. Which are the high efficacy diuretics? The loop diuretics are the high efficacy diuretics, and thiazide and thiazide-like diuretics are medium efficacy diuretics, and others diuretics are weak diuretics like carbonic anhydrase inhibitors, potassium sparing diuretics and osmotic diuretics. Now, I am going to discuss in detail about loop diuretics or high ceiling diuretics. Why loop diuretics are called high ceiling diuretics? Number 1, cause this is highly efficacious diuretics among all diuretics. It is effective even in severe renal failure and prevent about 25 to 30% of reabsorption of total GFR. Diuretic response increase with increased dose and rapid onset of action with short duration of action. This is so these loop diuretics are known as high ceiling diuretics. Now, the mechanism of action. Furosemide inhibit the transporter called sodium, potassium and chloride transporter in the thick ascending limb of loop of Henle and reduce the reabsorption and increase the excretion of the sodium, potassium, magnesium, calcium, etc. And it participates in synthesis of prostaglandin from the arachidonic acid metabolism, which increase the renal blood flow and glomerular filtration rate, and prostaglandin E to inhibit the salt transport in the thick ascending limb of loop of Henle and participate in renal action of the loop diuretics. Here are some pictorial diagram of mechanism of action of loop diuretics. Now, what are the indications or use of loop diuretics? Number 1, acute pulmonary edema and other edematous condition like left ventricular failure, heart failure, acute hyperkalemia, hypertension associated with renal insufficiency, chronic heart failure, resistance hypertension, hypertensive emergencies, hyperkalemia, acute renal failure and anion overdose. What are the toxic effect of loop diuretics? They causes some electrolyte imbalance like hypokalemia, hyponatremia, hypomagnesemia, hypocalcemia, etc. They also causes some acid based disorder called metabolic acidosis and reversible ototoxicity, hypovolemia, hyperuricemia, etc. Mechanism of action of thiazides. Number 1, it increases the excretion of the sodium and chloride and acts on early portion of the distal convoluted tubule and block the sodium and chloride co-transporter. This is a very important co-transporter that is situated in the proximal convoluted tubule. Decrease the reabsorption of the sodium chloride from the segment of the nephron and leads to delivery of the large volume of sodium and chloride in the rich tubular fluid to the segment and causes the diuretics with increased sodium and chloride excretion and resulting in excretion of the very hyperosmolar urine. This is the pictorial diagram of mechanism of action of thiazide diuretics, and the second mechanism is loss of potassium. It stimulates the exchange of the tubular sodium and potassium, and more potassium is exchanged for the sodium, resulting in continuous loss of potassium from the body and loss of magnesium. That is, thiazide increase the magnesium excretion and decrease the urinary calcium excretion. Urinary calcium, how it is excrete? The thiazide decrease the calcium content of the urine and by promoting the reabsorption of the calcium in the distal convoluted tubule, and calcium is actively absorbed by the distal convoluted tubule epithelial cell via an apical calcium channel and basolateral calcium and sodium exchanger. This process is regulated by the parathyroid hormone. Now, what are the indications of thiazide and thiazide-like diuretics? There are several uses and indications of these diuretics. Number 1 is mild to moderate hypertension, edema associated with disease like heart failure, cirrhosis of liver, renal disorder like nephrotic syndrome, and some drugs like corticosteroid therapy, estrogen therapy, etc. And some other diseases like nephrolithiasis associated with hypercalciuria, calcium oxalate stone in urinary tract is also the use of the thiazide diuretics. Nephrogenic diabetes insipidus and hypertensive elderly patient are the important uses of thiazide diuretics, because the elderly patient have commonly suffering from the osteoporotic. Adverse effects of thiazide diuretics: electrolyte imbalance like hypokalemia, hyponatremia, hypercalcemia, and acid base disorder like metabolic alkalosis. And the other adverse effects are hyperglycemia, hyperuricemia, and dyslipidemia. Potassium sparing diuretics. How potassium sparing diuretics acts? The mechanism of action is aldosterone receptor antagonist. Spironolactone is a synthetic steroid that binds with the aldosterone receptor in the collecting tubule and prevent the potassium excretion by the antagonizing the effect of the aldosterone in the collecting tubule. Thus, it decrease the synthesis of the sodium potassium ATPase pump and decrease the sodium and water reabsorption by increasing their excretion and increase the retention of the potassium. That is why that are called potassium sparing diuretics. And the other drugs that are sodium channel blocker, that is amiloride and triamterene, their mechanism of action is like they acts by inhibiting the sodium influx through the ion channel in the luminal membrane. Now, the indications of potassium sparing diuretics. Number 1 is primary hyperaldosteronism or Conn's syndrome, secondary hyperaldosteronism, cirrhosis of liver, nephrotic syndrome, heart failure, prevent the remodeling of the heart, and resistant hypertension, ascites in hepatic cirrhosis. Antagonizing the effect of the polycystic ovarian disease like block androgen receptor and inhibit the steroid synthesis, hirsutism in women, and combined with the thiazide and loop diuretics. What are the adverse effects of potassium sparing diuretics? These are anti-androgenic drugs, so that have anti-androgenic action. In case of male, they causes the gynecomastia, impotence, erectile dysfunction and loss of libido. And in case of women, they causes the menstrual irregularity and breast tenderness. And other adverse effects of potassium sparing diuretics are hyperkalemia, metabolic acidosis and aggravating peptic ulcer disease. What are the carbonic anhydrase inhibitor and how carbonic anhydrase inhibitors acts? Carbonic anhydrase inhibitors are acetazolamide, dorzolamide, metazolamide, etc. They acts by inhibiting the carbonic anhydrase enzyme activity in the proximal convoluted tubule of the nephron, and carbonic anhydrase catalyzes the reversible reaction like water and carbon dioxide. It produce the bicarbonate and depress the bicarbonate ion reabsorption in the proximal convoluted tubule, and it inhibits the 85% of the bicarbonate ion reabsorption capacity in the proximal convoluted tubule. The significant bicarbonate ion losses and hyperosmotic hyperchloremic metabolic acidosis occur. Now, what are the indication of carbonic anhydrase inhibitor? The indications are glaucoma, cerebral edema, urinary alkalinization, acute mountain sickness, hypokalemic periodic paralysis, etc. And what are the adverse effect of carbonic anhydrase inhibitor like hypokalemia, metabolic acidosis, drowsiness, paresthesia, fatigue, abdominal discomfort, hypersensitivity reaction and bone marrow depression. What are their contraindication? Liver disease or hepatic insufficiency may precipitate the hepatic coma. So, in this condition, this drug should be prohibited. And osmotic diuretics. What is the mechanism of action of osmotic diuretics? They opposes the action of the ADH hormone in the collecting tubule, and presence of unabsorbable solute like mannitol, glucose, inulin, urea, etc. prevent the normal absorption of the water and increase the urine flow rate, reduce the sodium and water reabsorption in the collecting tubule, and natriuresis occur, and this causes the excessive water loss from the body. What are the indications of this drug? Increase the intracranial pressure, increase the intraocular pressure, acute renal failure like severe trauma, cardiac surgery, hemolytic reaction, etc. That is all for today. In next class, we will discuss about another topic. Thank you so much.